I'm Dr. Simone Warrack, and I'm a pediatrician with Bell & Health. I decided to become a pediatrician in my third year of medical school. I had a couple rotations with pediatrics and felt like this is something that I could do all day, every day. I think the biggest reward for me is connecting with pediatric patients. They may be a little apprehensive when they first meet you as, not only like a new provider, but like a new person in their life. During my get to know you appointments and well checks, especially if they haven't been seen at our clinic before or haven't met me before, I like to talk about, kind of what we talk about during the exam. So looking at the height and weight, growth, measurements, developmental milestones, and things like that. And I always like to ask parents, how are their personalities? And just, hearing parents talk about their kids' lives and what they like, what they don't like, how they differ from each other, that to me is so interesting. I think, mental health is a huge aspect. We see, parents sometimes struggling with their 3, 4, or 5-year-olds with behavior issues sometimes, and sometimes that is just, typical for age, but, they may have had a child who was a lot more mellow or, easier, and now they have a child who's a little bit more emotional, and so managing those expectations. And then as far as the older children, we definitely see, some anxiety, especially going back to school. Friendship changes, like social media can play a huge part in, mental health too. So it's, talking about finding resources and ways to, help themselves at home, but also we have great mental health support within Bellin, and so I'm really happy to be here for that. We're not here to judge you, we're here to learn about your family and your child. So I don't want parents to be apprehensive about coming. If there's something that maybe a parent finds uncomfortable to talk about, sometimes I can relate to a similar situation that I've experienced with my child or my family, and try to reassure them that they're not alone.